welcome to the Dental Handoff. I have with me today one of my besties, Jessica Atkinson. You guys may know her from Dental Edge, the famous Jessica Atkinson. Jess, thank you so much for taking time today in your busy schedule.
Oh, thank you for the invite. I'm happy to be here.
So Jess and I met years ago. I think it was through EDHA, right?
I think that is how we met. I wonder if we had some other happenstance meetings, but when we spent the most time together was when we did ADHA stuff. We had the best job.
I think so
with
too.
ADHA.
Yeah. Awards committee. You were the chair.
Yeah, the awards committee is the best. If you ever are feeling the humdrums of the day-to-day in dental hygiene, I recommend that you ask to be on an awards committee, because what happens on an awards committee is you see the things that our colleagues are doing across the country, and it is inspiring. It's humbling. It's like it just lights the passion of dental hygiene in your bones. So if you're feeling a little humdrummy, it's the awards committee is where it's at.
Yeah. And we, like you said, there were applications to read and you're going, oh my gosh, I didn't even know this thing existed, because they would create their own opportunity. And I think in our bones, that's actually who we are as individuals. We create our own reality, right?
And the things that people go after because they find something that they are really caring about, and they see that they have a skill set to address the things that they're caring about, and they make a path and they change lives. And it just was the best. It really was.
Yeah.
So Kelly and I would get together and we'd read these things and we'd talk about how wonderful these people are. And we'd say, can't we just give everybody an award? But
and one of my favorite memories, Jess, is when I saw you at the ADHA meeting, and we decided that if, what was it? You gave me a nail polish color.
Oh.
And she renamed the nail polish color if nail polish could have a color, and it was code D4910.
Yeah, so we were talking about a number of the people on the awards committee. Not everybody. There are a few educators, and we were talking about how when break comes, like when you're on either Christmas break or summer break, is when dental hygiene educators paint their nails. And as you can see, we are not on break. Nice and short. They're nice, short, clean, the standard clinic nails here. But we were talking about how we paint our nails. And so I went to the grocery store, and I was seeing all these shades of pink and red. And I was like, this is what I want to give the committee that worked with me, is a shade of nail polish. I had like a 4342, I had like a, 43, 46. It was great. And I really spent probably more time than was necessary on choosing which color would be represented by the therapeutic code. I was like, this one's a little more 4+ teeth than 3 teeth. I'm like, oh, this one's
cyanotic.
Yeah, this is a little more involved. So I had a great time.
You never know what I love about our association is that you never know how you're going to interact, how you're going to connect. And that's one of the things that I've always loved, just the happenstance of the passion that we share.
The passion that we share and the differences that we have. One of the things we were talking about, I was talking with my program director. We had a colleague that has currently chosen not to be part of the association because she doesn't like it was a policy that was not a policy. It was now I'm not going to have the right word. Anyway, it was a stand. We're going to say it was a stand. And this particular stand was about about the idea that hygienists should be competent through graduation of a CODA accredited program. So that's the ideal. And our colleague is like, that's not that can't happen. We have programs that are much different across the country. And she has worked with a number of testing agencies and has seen things that we don't ever want to see. We would like all of our compadres to be at a competent level before they even take a third-party exam. And I was talking to her. I said, well, just because we have an ideal doesn't mean that we can't still have these checks and balances where we need checks and balances. And I hope that we're all trying to get to the point that every program would be a level and the quality that anyone who would graduate from a CODA accredited program would be competent. That's an ideal. So I would hope that if anyone's listening out there and is like, well, I can't be associated with an association that disagrees with some of the things that I would like to see, maybe I'm just asking you to consider that you can still be a part of an association and understand that there are nuances and variances in all of our hopes and dreams, and we still belong together, and we can do more together than we can do apart.
Yes. And you graduate at a novice competency level. It's novice. It's not an expert.
I mean, I don't know about you, Kelly, but I was not at the top of my game when I graduated from hygiene school.
There's still so much to learn. You're senior. So let's learn about you, Jess. You're an educator. You're an educator.
Yes.
And because we've got ahead in the story, which I love. So you're an educator. You're senior clinical coordinator director, right?
The title is Senior Clinic Coordinator.
Okay.
So I am the Senior Clinic Coordinator at Utah Tech University, which is in the beautiful state of Utah. And I am at the southern tip, which means I'm closer to Vegas than I am to Salt Lake, which is our state capital. And if you're familiar with any national parks, I live right outside of Zion National Park. So I've got queen bunk beds. Come visit. It's beautiful. It's lovely. And education is my passion. I love all things education. So while I do have a full-time faculty position here at Utah Tech, I also run a company called Hygiene Edge with two of my dental hygiene besties, Shelly Brown and Malia Lewis, where education knows no bounds. And that's been a highlight of my life.
So it's really your education through and through. That's your heart.
It is my heart. When I was growing up, I either wanted to be a teacher or a dental hygienist. And gratefully, I chose the profession that I could do both.
Yes.
So,
yeah, it chose you. It sounds like
it. Yeah, I'd like to think so. I'd like to think that my bones knew what I wanted, and dental hygiene was where I found it.
Did you, as an educator, when you decided to go into the profession as an educator, because you were probably clinical, went into education, what was the main thing that stood out to you as a contrast from when you were a student? You always thought that educators were like this, but really it was like this. What was like the one thing that was surprising to you that was true about educators?
I was I think they would consider me a non-traditional student, meaning it took me until I was 26 to get into dental hygiene school. Not that I was an assistant for a lot of years. I took a hiatus and went on an ecclesiastical mission for my church, and a number of things happened in my life that dental hygiene school didn't happen for me until I was 26. And so I actually had a lot of dental experience before I went into school. And the school that I graduated from, you had to have 5 years of dental experience before becoming an educator. And I was only a year out of hygiene school when I became a clinical educator. So I got back into the education scene very quickly. And the thing I had really good relationship with my educators as a student, and something that maybe surprised me. what surprised me, I think as a student, you think your instructor has the answer, that
Mm,
they know, they just know the answer. And as an instructor, and we've already talked about this, is there's still so much to learn, and
mhm.
there's so much to build upon. I tell my students when they're right about to get ready to take boards, I'm like, guess what? You're actually smarter than me right now. You have a quicker recall on things like Bud Cap Bell
Yeah.
and all the names of things that have long since passed in my brain. However, I do say, but you will never be more experienced than me. So there's that. And there's something to be said about experience and being on the education side of things, recognizing that with experience comes the, hopefully still, the pattern of finding those answers or working through those problems and coming to a better resolution. So that's, I think, what surprised me is that, oh, they're still in this with us. We're all in this together. And
Yeah.
not to be such a hard critic of when an instructor has an opportunity to change, or an instructor has an opportunity to grow, or
Mhm.
an instructor has an opportunity to be corrected, which happens.
Yeah. Oh, yeah, because I feel like in education and as program director, I learned different ways of thinking every day from the patient interactions, from how perhaps even potential bias affected
Oh,
certain
yeah.
things of it's the nuanced things, right? And it wasn't about holding a scalar or a perio probe at a 10-degree angle. It had nothing to do about that. It was about the human interaction, which I found so fascinating. And what was the right way to do that? What was the right way to handle that situation, or to talk about that, or connect something with the patient based on their values?
And meeting them where they're at.
Mhm.
I love that. I think when people ask me, why did you go into education? Did you not enjoy clinical hygiene? And I love clinical hygiene. I love clinical hygiene. I love the office environment. I love collaborating with other dental professionals. I love clinical hygiene. And I love seeing patients change and grow. The thing
Mhm.
about being in an office is the most I saw my patients was maybe once every 3 months, right? On our perio maintenance patients. But with education, I get to see someone go from a junior student to realizing their dreams. And I see them every day, and I see them tackle really heavy hurdles and really tough problems, and really look at themselves and go, I can I do this? And come out on the other end saying, I can do this and I did do this. And that is the best. It's the best. And that's that human connection of let's talk this through. What kinds of questions can we ask ourselves to go from this point to the other? And I really like that.
Yeah, and I love too that while we're in the middle of hygiene school or anything difficult, we're thinking, man, this is so hard. How am I ever going to make it through? But time and time again, when you look back retrospectively at your life, the common theme is that you always figured it out. You, if it was for you, you figured it out or better, and it turned out way better than what you thought. And like I tell most dental hygienists, I mean, if you can get through hygiene school, you can do anything.
Oh, I tell, they're like, oh, should I go get a master's degree? And I was like, listen, my master's degree was way easier than hygiene school. So you can do that. You can definitely go and get a master's degree. And I'd like to just add to that lovely explanation of what's the common denominator as you figure it out. I'd like to add that you don't have to figure it out alone,
Mhm.
that there are people that have had experiences before you that can offer aid, that can offer perspective, and that can help you maybe see yourself differently than what you're seeing in yourself. And that's one of my favorite things about education and working with the team that I work with is talking with students and helping them see something that they maybe don't see in themselves. And sometimes those things are areas of improvement. And some of those things are the hurdle that you have is not believing that you can do it,
Yeah.
is having an attitude of I can't when really you can. And you will be so proud of yourself when you do.
Yes. It's when you change your mind, you change your mind
Yeah. Yeah. Exactly.
every day. So you are clinical coordinator, you're doing Hygiene Edge, and I'm thinking about too the dynamic of dental hygiene and how it's changed since I've gone to school since in the 1900s, right? Where it was very intimidating and scary, and most of us cried on those days. And how much it's changed with the environment that is support. It seems more supportive now. Have you experienced that transition, Jess?
Yeah, I have in to a degree. What I mean to say is my alma mater, I went to the Utah College of Dental Hygiene and I loved my education and I felt really supported, even though we have a very rigorous curriculum. And I think that's one thing that's hard is that you have people who went to school in the 1900s and have horror stories. You have
Mhm.
horror stories about how you were treated. And I'm just like, how hygiene school is hard enough.
Yeah.
And so I have to be careful not to get on a soapbox with students of like, I had to walk uphill in the snow both
Both
ways.
ways. Both ways.
You guys, and there's also a little part of me that's like, you have it so good. Like I would like to give you some perspective here that even though it's a really challenging program, hygiene has come a long way in education, and I feel that it's a more humanistic environment.
Mhm.
And I've had situations where students needed some accommodations that weren't available when I was a student.
Yes.
And now we have a little bit more opportunity to provide that humanistic experience for them. When I I remember I went to school with a scratched cornea. I was terrified of missing clinic, and it was like there's no options. How I felt as a student is there was no option to miss
Yeah.
clinic,
Oh,
and
yeah.
so I'm like I'm on a I was
Sorry, I'm not
yeah.
meaning to laugh.
No, it was funny. It was funny. It was funny, but I had a scratched cornea. It was miserable, and now it's there's a more humanistic environment, I hope. And if any of my students are listening to this, yes, like if you're feeling a level of stress that is putting you in a position of like an unhealthy situation, there are people come and talk to us. Oh,
Mhm.
let's de-escalate some situations that you might be feeling really overwhelmed about. And it's a tricky balance because there is a competency level. There are standards, and most of the conversations I have is to reassure the student that they are up to the task.
Yeah.
These students have already come through so many hurdles to even get into dental hygiene school, and just to remind them how far they've come and that they can still do it.
Yeah.
And it requires effort, and hygiene school responds to effort even though you feel like it does. And one day you'll be like, oh, I do know how to remove calculus. Staged and graded that patient correctly, and uh, my patient came back. It really does. It works out.
Yeah.
It works out.
Yeah, because you feel like it's such a slow process, but then one day a light bulb goes on and you're going,
Yeah.
"Wait a minute, I can feel that now? Is that what that's supposed to feel like? Wait a minute.
Hmm.
How did I
Hmm.
know how to hold it like that to access that?" And you
Hmm.
feel like I feel like in hygiene school, and probably this is in a lot of areas of life, but we're comparing ourselves to what we think it should look like, which is,
Right.
of course, excellence and all the things to our instructor and our hygienist that we've had.
Hmm.
But it's all of that, those adjustments, those small little tiny adjustments, and the coaching and the mentoring and the teaching and the learning and stepping back from it along the way that we all had to go through it. We all had to go through it.
And they're often comparing themselves to a peer, and it's
Mhm.
just not fair. You can't compare yourselves to your peer. I often will tell a student, if there's a problem, your instructor will address it with you. If you're looking around being like, I'm not getting this, and you're creating a problem that doesn't exist, that's going to make this harder. If there's truly a concern, your instructors are the people that you need to be seeking feedback from.
Yes.
Not, don't be looking side to side going, oh, am I as good as? You're no longer in competitive mode when you're in school. You're all in this together.
I experienced that in consulting, where we're still the same way when
Mm,
we got in private practice. And we're comparing ourselves to this, and it can become that competitive environment and when we get like that, you guys, it can make us feel very isolated. We isolate ourselves because we feel less than or greater than something else, when it's just it's a ruse. It's not real. We're all in it together.
right. And when you isolate yourself, then you cut yourself off from opportunities to grow. And you cut yourself off from opportunities to be validated in the places that you are doing well. Ooh, isolation. No
Yeah.
bueno.
Yeah. I always liken it to popcorn kernels. We all pop at a different rate. Every
Oh,
popcorn
yes.
kernel
And
pops.
you're all delicious. We're all
Yeah.
delicious.
Yum, yum. My favorite snack. So it's, I guess, to take that forward to how you show up in private practice, know that you can learn from the person next to you. They can
Absolutely.
learn from you, and to hold that open space for them for differences as well, because it's not one size fits all when we are in private practice, and based on it's based on patients' risk factors and what they value and all the things that we were talking about initially.
Absolutely. If I had a magic wand, I would wave it around and have us stop comparing ourselves and work more collaboratively with one another. I Some students go out into practice and they feel like they don't have anything to offer. And I remind the students, you've just had the most cutting edge education on AAP classifications, on certain instruments that the offices that you're entering maybe haven't even considered.
Right?
And it is an opportunity for you to raise the tide. And I hope that they're given that opportunity to
Yeah.
collaborate and to be in a position that they're not only learning but are teaching.
Yeah. We were talking, you guys, before we got on. I know the program director, Brenda Armstrong. Many of you guys know
She's
Brenda.
the best.
And Brenda and I helped work together here in Williamsburg, Virginia, to open up, which used to be formerly Thomas Nelson Community College, which is now Virginia Peninsula. And Jessica has the fine pleasure of working with Brenda every day.
Me
So we were
too.
joking about, like, is there a chill person in education? Is there usually like a chill faculty? Because I know that my faculty, with all love and intention toward them, man, everybody was high strong as it came. And it was just like, but. And Brenda was that for me. And I would,
There's a drive. There's a drive for excellence, and there's a drive for yep, yep. Definitely a drive there.
so is there room for chill in education and your team? Are there times where you're just like, hold on, you guys, can we just like chill for a minute?
I What's funny is there room for chill? I had a memory pop in my mind. I want there to be room for chill and see you're talking to the educator. Like I where people try to insert chill, like I like just don't insert chill on things like infection control.
Right. Yeah.
Like when people are like, why can't I wear my mask under my chin? Like, why are you so high strung about this? That's when I'm like, my eyeballs are
Yeah,
gonna explode.
that's
How,
yeah.
but I think that lends to this high strung. I'm finding myself being like, maybe I do need a little more chill. Maybe I need a little more chill, but because there is a standard. There's hard to find what is perceived as chill in scenarios where there is a standard to be met. So I think we can look at there being a chill in when there is a mistake made, instead of making a huge deal out of it, have it be a little more chill approach.
Yeah. Yeah.
So I think that's where, yes, yeah. So the answer, Kelly, is we could use some chill. We could use some chill. And I mean, I'm up to give me some suggestions on how we find that chill when we do live in an environment where there are certain things that have to be.
Well, yeah, and I know that sometimes we're the best, I think, at finding plan A through Z for something. Like if we think that something could be possible, we're like, all right, well, if this happens, then this. I mean, I say if the world goes down, I want to be around hygienists because we have got a plan. We have got something in our purse or on our desk to figure stuff out.
Malia Lewis always tells me, she's like, hygienists are the smartest people I've ever met. And I agree with her. Like we are really smart. And I think I'm learning, I'm gonna do some thinking, Kelly, on how I can incorporate a little more chill into my, maybe it's like a Zen hour out. I'm gonna think about this.
Yeah, so like boundaries. When I was program director, I had like a little thing I would put on my door that said, "Do not disturb. I'm in a meeting." And because there are some things, otherwise it's Dr. Tanner, Dr. Tanner, Dr. Tanner, Dr. Tanner, being senior clinic coordinator. And I was right in the clinic and I'm like, you guys, I have to call this vendor. I have to order these textbooks. I have to do the things to be on the phone with the dean, and to make that space for your own personal chill, because otherwise, if we don't watch our chill, this could be like a whole other episode.
I'm feeling that. I'm feeling like a spin-off of what does chill look like? And I've got this in my, I don't know if you can see it in my face, but I'm like, yes, we need chill. And yes, we need to wear socks that cover our ankles. Yes, we need chill, but yes, we shouldn't have acrylic nails. Yes, like this is a good. I think there's more here. There's more here.
I know because I've seen the clinic manual. The clinic manual, a lot of them, and it's like you cannot wear hoops or you will die. I mean, it's just like that.
And for example, okay, this is a good example. We do have a little more chill. We used to have a one earring policy. You could have one smooth surface earring, and then we're just like, why one? Why can't you just have as many as you want, as long as
they're satisfied?
Like right. So, but we would ask ourselves. So there were a few policies that we attempted to be more chill at. So we looked at all of the research. We talked about earrings and we talked about nail polish. And earrings came back. They can have as many earrings as they want, as long as they are sanitary, right? And then we went to the research for nail polish, and it's like, well, you can have nail polish if it's not chipped. And we were like, okay, if we really want more chill, then we're just going to say no nail polish. Because can you imagine?
No,
policing?
Let me see.
Yeah, no, thank you. So yes, there are efforts. All of you students who feel like your teachers are no chill whatsoever, know that we're trying.
We're trying to chill. But here's the difference, Jess, is that if we had chipped nail polish or whatever that was, they'd be like, nope, you get a non-mastering decision making and you go home. That's 1900 style right there. So I'm just saying, there's been some chill.
I had what was called an ethical infraction, and it was 1% off of your grade.
Oh,
I know. Hard knocks.
Yeah. I mean, this is why we cried, because of chipped nail polish, But there's room for improvement. I'm just saying, it starts with us. And I just wondered if the number.
We'll do a spin-off, Kelly. We'll get Brenda in on this.
Oh, I would love to have Miss Armstrong, Miss America.
Yes. We'll get her in. We'll get her in on this conversation about chill.
Okay, cool.
That'll be good.
Yeah. Well, thank you so much for being on today. I adore you. Thank you for all the work that you're doing with Hygiene Edge. And you guys just hit a major milestone on YouTube. Yeah.
We did. And I don't know if you can see it. No, we can't see it, but our play button, our 100,000 followers. And it's been,
how did they just send that to you? Like, you just show up in the mail? How did that even happen?
There's a process. There's a process, and you put in information, and then they'll send it to you. And there are 3 of us, so there was a little bit more process to get each one of us a play button, and it was a really lovely thing. And it's been, I'm very grateful for my interactions with Shelly and Malia, and it's really enriched my life as not only an educator, but a clinical hygienist and as a person. So it's been to see the reach, to provide a place for people to come and ask questions that maybe they feel are stupid. So there's some chill there. Like, there used to be a lot more toxic environment to ask questions or to maybe not know something, and hopefully we're making a change there.
You are. And I even saw it with my students. They would say, well, I watched this video. I'm like, wait, who's it from? They're like, Hygiene Edge. I'm like, okay, go on.
Yeah.
And I'm like,
and that is what's nice, is the 3 of us all have been educators. And so we know that sometimes we've got to make sure that it meets the no chill bar as well. Like, this is from text. This is how it is taught in hygiene school. So it provided educators a resource that they didn't have to create, which was a huge, huge help. So
yes. Yeah, because even we could watch it back and say, oh, I didn't think about that. I guess you can do that. Because otherwise students would be, I'm watching this, and then look at how they're holding that, and that's different. So I should have gotten a 2 instead of a 1 on that. And
then you got to be like, yes.
Another episode.
Oh my gosh, we already have like 4 episodes we can talk about.
I know. So thank you so much for doing that for all of us. Thank you.
Well, it's been a pleasure.
Yeah, Jess, I can't wait till I can see you again. And any final parting words that you want to offer the audience?
Keep learning, keep loving, and let's do it together.
Yeah, love that. Thank you again.
And thank you.
For all of our listeners, you guys know I appreciate you so much. Thank you for listening in week after week. I always ask the favor of giving 5 stars on Apple Podcasts. Go on over to Apple Podcasts, 5-star. Go over to YouTube, subscribe, press the like button on this right now, and share with your friends and people you love. Get the little ding. So we will see you next time. Thank you for all the lives you touch. Mwah. Love you guys. Take care.
Thanks, Kelly.
Thank you.